Hello, and welcome to the 49th Annual NAPCRG Annual Meeting. My name is SPDavid, and I am privileged to present on behalf of the Coronavirus Pandemic Epidemiology Consortium on the topic of mental health outcomes during the COVID-19 pandemic. I first wish to acknowledge the developers of the COVID symptom app, our funders, and our disclosures are below. As we all know too well, we are still in the midst of a global pandemic that has infected more than 220 million people and caused nearly 5 million deaths from COVID-19. Preliminary results from the COPE Consortium using the COVID symptom app described next identified cigarette smoking as a risk factor for infection and more severe infection. Given that more severe mental illness, severe COVID infection increases risk for post-acute sequelae of COVID, we first sought to explore the relationship with smoking. But our results indicated that smoking, vaping, and alcohol use actually decreased during the pandemic in the populations we evaluated. So we present results from a mental health survey administered to COVID symptom app users assessing the impact of the lockdown on mental health, including related behaviors. And due to the disproportionate impact of COVID on communities of color, we explored differences between the ethnic racial groups in the United States and the United Kingdom. We performed a cohort study in the US and the UK of the COVID symptom app users. The COVID symptom app was developed by Zoe Limited in the UK with collaborators from several universities in the UK and the United States and elsewhere. And there were more than 1 million downloads in the first 48 hours of its release in March of 2020. Our data include results from a mental health survey administered in February of 2021 that tapped history of mental illness, screening for current depression and anxiety, and changes in behavior, lifestyle, stress, and demographics during the pandemic and the lockdown. The results showed that there were more than 690,000 participants who had downloaded the app and had completed the mental health survey. Key demographic differences are that white participants were older, reported higher income and educational attainment, and were more likely to have reported a mental health diagnosis in the past than non-white participants. In the United States, multivariate odds of screening positive for depression were statistically significantly higher for Black, Latinx, Asian, and individuals of mixed descent, even after adjusting for prior mental health diagnoses, COVID-19 infection, community-level income, crowding, COVID restrictions, and other covariates. Rates of anxiety were comparable between groups, except that compared to white individuals, individuals of Latinx background were more likely to screen positive for anxiety. And in the United Kingdom, individuals of South Asian, Middle Eastern, and East Asian descent were more likely to screen positive for depression and anxiety. Slide 9 presents the multivariate analysis results for depression and anxiety. Although not shown here, the highest risk individuals for depression were actually Black healthcare workers. And there were no statistically significant differences between groups for lifestyle behaviors, including smoking, vaping, and alcohol use. The latter three behaviors actually decreased during the lockdowns in the United States and the UK, as shown in this figure. So in summary, the results of the symptom map across 2 countries highlight the disproportionate mental health burden borne by racial ethnic minorities. There was a statistically significant increased risk of screening positive for depression for Black and Latinx individuals in the United States, an increased risk for anxiety for Latinx individuals in the US and Asians in the UK. These differences in the many social and structural conditions that contribute to them need to be considered as healthcare systems transition from prioritizing infection control to preventing and addressing the long-term consequences of the pandemic. Thank you very much for your attention, and I'd like to continue to thank all of my collaborators and all the participants who use the COVID symptom app.